the only purpose of these dyes is to make foods more attractive and appealing.
The mandate of Kellogg's is to show profit.
We never really studied it the way we should have. What's the benefit that the American consumer gets from these dyes? Kids should have a million dreams. Sick kid has one, and that's to get healthy.
The agencies are also behind this because that has never happened. That's actually bringing change in a way that we've never seen
That's
before.
right. We're no longer going to be reactive, we're going to be proactive.
It's pretty clear that the combination here is not doing well for humans.
60 to 70% of our foods now are ultra processed.
Food is very, very addictive now, and it's been engineered that way. Kyle, good to meet you.
Absolutely, great to be here. Thanks for having me.
Thanks for coming on the podcast.
Yeah.
So you just told me before the podcast, you are the F in FDA.
That's right.
You are the Deputy Commissioner of the FDA. So you run the food side of the FDA.
That's right. Deputy Commissioner for Food. So run the food side of FDA.
We have a lot to talk about, my friend.
We do.
Okay.
I don't know if we have enough time. We got a lot to talk
I
about.
know. Well, we're gonna try and squeeze every minute out of this. What is your background? How did you come into this? Because from my perspective, the food system in the FDA is badly broken.
Yeah.
You're just coming into this role. Did you see that?
Correct.
Before this?
Yeah, so I've been involved in the food industry since I started my professional career. I'm a lawyer. I've been doing food and beverage law my entire career. And so I've sort of seen every side of it. I've seen the FDA side. I've seen the private sector side. I've seen the side of the environmental groups. I've seen the side of the moms and the consumers. I've seen the side of the investors. So I feel like I've had a unique perspective on sort of the entire supply chain from farms to mouth with respect to foods. And, it's an area I've been passionate about my entire career. Super fortunate to be here to work with Marty McCary, Secretary Kennedy.
Right.
Really great team in place. I mean,
Yeah, it's an amazing
we've
team.
never seen in the health agencies such alignment between the president, the secretary, the commissioner, all the way down. We've just got a fantastic team, and it's a really exciting time at FDA.
What do you see when you look at the FDA? Do you think it's broken? Because I look at our food system right now and the number of additives in our food, and I think, like, how did it get this way?
Yeah, look, I think there's reform that's needed, right? And we're taking those steps to do that.
Okay.
It really goes back to the 1950s. The law was passed creating the food additive amendments. This is essentially a system where Congress said there's issues. If you want to be used in food, you gotta file a food additive petition to FDA and get approval.
Right.
But in doing that, they also created an exception,
Right.
generally recognized as safe, GRAS.
Right.
And Congress said, if you're generally recognized as safe, you don't have to be approved by FDA. You can essentially get in without that approval process. A backdoor of sorts.
Yeah.
And there were sort of idealistic visions behind it at the time. It was anticipated to be things like salt, baking soda, corn, wheat, things that have sort of historically been in foods for hundreds, thousands of years. Right. But our food supply changed. Right. In the 70s, 80s, 90s, even before that, there was a huge push for food security to add preservatives, to extend shelf life, to create products that were shelf stable. And again, like, that wasn't done with ill intent. We were doing it from a food safety perspective, a food security perspective.
Right.
All these new ingredients, these preservatives, emulsifiers, additives were put into the food supply, and they were largely done through the GRAS process.
Right.
And Congress and FDA tried really hard to say, well, maybe we have a mandatory GRAS system where we have to do it. We have to review everything. It became unwieldy. FDA basically said, we can't do it. They allowed companies to essentially self-GRAS, which means they can hire their own experts. Theoretically, they're supposed to meet the exact same safety standards as a food additive petition.
Right.
But companies could do it on their own. They didn't have to tell FDA. They didn't have to tell anybody. They didn't have to put their data out in the public domain. So companies were able to essentially self-certify that an ingredient was GRAS, put it out to market, and FDA had no way of tracking that. We had no way of knowing. And so, unfortunately, the GRAS loophole, as people call it, sort of swallowed the rule itself and became the primary mechanism where ingredients were getting on the market.
So in the 1950s, when this law was created, when this sort of backdoor loophole was created, like you said, it was mainly created with the idea of salt and wheat and like simple ingredients going on. The 10,000 plus additives to food didn't exist then.
That's correct. That's correct.
So there was no real awareness that this was going to happen, and it's kind of become its own monster in this,
That's right. We couldn't have predicted the proliferation of new novel ingredients that would be used in foods.
Right.
The additives that extend shelf life, they preserve quality or freshness or prevent things from caking or binding.
Which sound like good things,
Correct.
but may not always be good for human health is the problem, right?
These were ingredients created for idealistic purposes,
Right.
To increase the food supply, to make products cheaper, to make it more shelf stable,
Right.
to allow families to put stuff in their pantry for a couple months.
Right.
But we didn't necessarily know the long-term health effects of that. And we never really studied it the way we should have.
Right.
The way FDA has historically worked in this space, once an ingredient was on the market, there wasn't a robust framework to continue to review that data. So if you look at drugs, you've got obligations in places to continually review the safety of data. Food never really had that formal process in place. So ingredients would get on the market and they would just sort of stay there. And FDA would react and we take action in response to a citizen's petition or there's a congressional inquiry.
Right.
But we never had a formal review process. So we're standing that up now. We're changing that.
That's amazing.
We're
So
doing
there's
that now.
going to be a formal review process for additives going forward
That's right. We're no longer going to be reactive. We're going to be proactive.
for new things coming in.
Both.
Okay, so we're going to
new
look
things,
back.
new things coming in.
Mhm.
We're going to address GRAS. We're not going to have a GRAS loophole. We're taking steps now to close that GRAS loophole.
Mhm.
On the back end, things already on the market. We're standing up a post-market framework so that we could prioritize chemicals of concern in the food supply. So we're
Right.
going to put together a framework that's going to look at, is there new safety data? Is there concerning data? What are other countries doing? What are consumers worried about? What are the states seeing?
Right.
Are the states passing laws banning certain ingredients? So we're going to create a framework that helps us assess how we should prioritize our post-market review. And then we're going to start reviewing these things. We're going to expedite review, and we're going to stand up for the first time a formal framework to review in the post-market context ingredients that are already in the food supply. Well, we also close the loophole on the front end with GRAS.
So we might be able to get some of these things out of the food supply once we review them in a post-market way.
That's right. So
Hopefully.
we're gonna use gold star science and
Yeah.
we're gonna use common sense. And if the data shows and science shows we should get rid of them, then we'll take steps to do so.
It would be pretty disruptive for the food industry. I mean, I imagine the lobbying pushback is going to be pretty massive here.
I think that's probably right. There's also companies that want to do the right things.
Really?
There
That's
are,
good to hear.
There are, and there's other considerations, not just demand. Like the dyes, for example,
Right.
that's driven by consumer demand
Uh-huh.
and state activity. Industry really came to us and said, we're really worried about this proliferation of state laws. Consumer demand is trending heavily away from the use of dyes towards natural colors.
Yeah.
They want a federal framework. They want FDA to stand up and help with that. Or we're going to have some big announcements in the coming weeks on dyes.
Amazing.
They're going to be a game changer.
Okay, that's fantastic because, like you said, so at first it starts with salt and wheat and these additives. Then it goes to like these shelf-stable ingredients, and it seems like recently it's become this like huge proliferation around natural flavors, which can
Yep.
be so many things. It's just this like
Yep.
black box. In some ways, I have no idea what that is, and the food dyes and these other ingredients, and you look at, I don't know what these things are. And so, I think, and maybe I'm wrong about this, that in recent years, we're just getting more and more. I don't know if the word is processed. You're just getting different type of ingredients added to foods
Yeah.
under the guise of emulsifier or shelf
Yeah.
stabilizer, and you're seeing more and more potentially problematic ingredients. So because a lot of the stuff that's in foods now, you look at these labels and you think, I've never heard of that. I can't pronounce that.
That's right. There's a lot of ingredients. You look at a food label, there's a lot of ingredients
A lot of
on it.
ingredients.
It's the proliferation of ultra processed foods. 60 to 70% of our foods now are ultra processed, right?
Crazy.
And what does that mean? We're going to figure out what exactly ultra processed means. And you're going to see the MAHA report today really talk about the potential risks associated with these ultra processed foods, added sugars, other ingredients that are used, stabilizers, preservatives, things that have not historically been in our food until very recently from a historical perspective. And, we're really excited. We're investing with NIH, in a joint partnership with NIH to really study ultra processed foods.
Amazing.
And we're really excited. We think the science is going to lead us to some potential game changers.
I think it is because when I look at it from 15,000 feet, I think we're becoming obese. Rates of all the chronic diseases are rising, autism, cancers, prediabetes in every age group. And you think, this isn't all just driven by calories.
Yeah.
Two things are happening in my mind. One, food is very, very addictive now. And it's been engineered that way to be so addictive.
Yeah.
And so we're eating more. So we're getting more calories. But I don't think that all of the harm of this ultra processed food is that we're eating more. I think it's also that these ingredients, that some things that have gotten in through the GRAS standards are probably harmful for
Yeah,
us.
look, the reality is there's not one ingredient, not one chemical that's to blame. You can't blame just the dyes. You can't blame just preservatives. There is a chronic disease problem in our country that's associated with a lot of things. Are food ingredients part of that? Is the ultra processing, the stripping of wheat, the adding of these ingredients, is that part of the problem? Absolutely.
Yeah.
And we're working hard to study that, to address these issues, to see, should we be eliminating some of these ingredients? Should we be restricting their use? Should we be lowering the levels that they're allowed? There's a lot that goes into it. I mean, I do want to say that, the dyes, for example, great, but it's not the solution. It's not the end all be all. There's a lot of things that go into this in cleaning up our food supply. And it's not just ingredients too. It's consumer transparency. Let's make consumers more aware of what they're eating, right? Let's help with labels, transparency. Let's give consumers more choices. Let's let them understand what's in the food supply. And you'll see in the report today, there's other things that are part of this chronic disease problem. There's kids not going outside and playing.
Yeah.
When you and I were kids, I lived outside.
Yeah,
I don't know about you, but I lived outside.
Me too.
Today kids are sitting on the iPads, they're sitting in front of TVs, and there's a number of things that are, associated with our chronic disease problem. Foods is a big part of that, but there's also other things that this report today addresses that I think is really going to be insightful to a lot of people.
And I think it's also the cumulative effect of all these things on our health. I mean, food dyes are one piece, and I've seen people criticize food dyes saying food dyes are not causing the chronic disease epidemic. And I think, yeah, but they're a piece of the puzzle. Like, they don't need to be in there. And we don't understand how the food dyes are interacting with emulsifiers, are interacting with pesticides, are interacting with processed sugar. It's a milieu. And we're not easily going to be able to disentangle this.
Yeah.
So let's just take a really simple perspective with common sense and say, it's pretty clear that the combination here is not doing well for humans.
Yeah. And look, the reality is, like, on the food dyes, they have no nutritional benefit, no functional benefit.
No.
Right. They don't preserve the food.
They're not used in Europe.
They're only used to make foods more attractive.
Yeah.
They colorize foods. Industry likes to use them because they can have a consistent color across batches, right? But the only purpose of these dyes is to make foods more attractive and appealing.
Yeah.
And the more attractive and appealing a food is, the more likely for overconsumptive behaviors to develop. It feeds obesity. It feeds diabetes risks. And there's no nutritional benefit to these dyes. So why are we using them? What's the benefit that the American consumer gets from these dyes?
In addition to the hyperpalatability or the actual visual appeal, are the studies looking at behavioral changes in kids or these other sort of downstream effects that we could never have anticipated.
Yeah, look, there's
petroleum-based chemicals.
There's growing research on that. You saw the state of California do some research earlier this decade. West Virginia just passed a law.
Yeah.
There's 30 states right now that are contemplating legislation on dyes. And the industry, largely to their benefit, has realized that this is happening. It's driven by the states and consumer demand. And they want us to put a federal framework in place. They want us to do it at once to prevent sort of that competitive advantage that companies could have. Right. So we're excited to work with industry on this. And we think we're going to have some big announcements coming in the very near future on
That's
this.
great.
Yeah.
I think we also got to be fair, I'll say it, like Kellogg's shut them out. These guys marched to Kellogg's headquarters in Battle Creek and they were like, we don't care.
Yeah.
So the industry hasn't entirely been,
Very fair. Very fair.
And I think that look, it's kind of it parallels the pharmaceuticals where we live in a society of capitalism that the mandate of Kellogg's is to show profit.
100%. Fine. They're a for-profit company. That's their mission.
Okay. That's their mission. And so I think that it takes a village. It takes attention from all sides.
It does.
Things like this, the consumer's pushing back, and then Kellogg's is probably willing to say, okay, we'll take them out.
And that goes to the consumer demand perspective, because if there were not the moms and the consumers saying, we don't want these products, we want alternatives, it would be a much different place we're in right now.
But it's amazing. And this is what we talked about at the beginning. It's so cool that you, Marty, Bobby, the agencies are also behind this, because that has never happened.
It hasn't.
It has never happened. And so it's this incredible nexus of consumer demand, social media awareness, and government sort of, cooperation.
That's right.
That's actually bringing change in a way that we've never seen before, which is amazing. So we've got the food dyes. Can you talk about anything else you guys?
So we have GRAS in the works.
Yeah,
that's a big one. We're going to have
any other ingredients that you're thinking about removing? Are we going to?
We'll be putting out. We just announced our framework for the post-market review. We're adding some chemicals to that, and we have a list online right now that shows chemicals we currently have in review. We're going to be adding to that very soon. We're going to be adding more chemicals. We're going to be expediting those reviews. So a lot more to come on our post-market work, but we're absolutely committed to both pre-market and our post-market framework, getting that stood up and providing more transparency.
Thank
to
you so
American
much
people.
for doing that work, man.
Yeah.
It's amazing.
It's a pleasure.
I can't wait
Yeah.
to see it. I think it's all steps in the right direction. I think that it's little bites, little
That's right.
steps in the right direction that are going to make a big impact long term.
Yeah, look, it's unfortunate that there's some politicalization in the space because food policy, nutrition should not be a partisan issue, right? Like when we're looking at this stuff and making decisions, we're not thinking about Republican kids and Democrat kids. We're thinking about kids.
Yeah.
Right. And to borrow a line from Secretary Kennedy, kids should have a million dreams. A sick kid has one, and that's to get healthy.
Yeah.
And if we can take even minor steps to help children achieve that, help a percentage of our children get to a better place, it's all worth it. So that's our mission. That's our goal. We don't put partisan politics into it. This is really to benefit America and American children.
I love it. What did you have for breakfast this morning?
I had a coffee and then I had a bag of beef jerky.
Yes, lineage beef jerky. That's what we gave you. Yeah. I'm happy that I can give you some breakfast.
I appreciate it.